If I didn't have the supplies that I needed, it would make giving patient care pretty difficult, if not impossible.
We are 100% reliant on the supplies in our unit. We are the only pediatric part of the hospital, of an adult hospital, so we have a lot of specialized equipment. And to save a 1-pound baby, we have pounds and pounds and pounds of supplies and materials that we use. And if we're out of them, it's just really handicapping for us to do our job.
When you're removed from the hospital and from that direct patient care, sometimes you forget what we do in supply chain and how it affects patient care.
Sometimes you can get lost in looking at those numbers and the pricing and so forth, and you forget about maybe how does it affect the patient.
We had just returned from a soccer game for Avery, our oldest daughter, and it was early evening. And then that's when I heard Carrie yell from our bedroom that she thought her water broke, right? Is that?
Well, it had definitely broke.
Yeah.
And it was followed by the strongest, hardest contraction, like completely paralyzing, cannot move. Got my phone, called my mom.
Got the kids situated with the grandparents.
Ran to the car.
And started down the road.
As fast as we possibly could.
The hospital, Intermountain Medical Center, is about 30 minutes away.
It's 35 minutes from our home.
Yeah.
I was trying my best to remain as calm as possible. I really focused on my breathing, but I was frightened. Shane was going 100 to 110 miles an hour, and we made it to the parking lot.
And it was after hours, so I just banged on the door. Within seconds, the nurse ran outside with a prepared kit.
And while he was gone, I delivered his head. Shane said, "Get in the wheelchair," and I said, "I can't, I'll sit on his head." The nurse got there just in time to hear me say that, and so she looked and she said, "Push!" And she got there just in time to catch him.
Because we're in the healthcare field and healthcare industry, there is meaning because that box moves from our fulfillment center or from one of our suppliers to a hospital, to a clinic, so that we can provide high quality patient care. And if all supply chain professionals have that as an end goal in mind, that they will be able to find meaning in their jobs.
It's nice to know that I have an impact and helping someone to live a healthier life.
So for me to touch through the contracting part and for the supplier solutions part, to touch every one of these aspects of people's lives, it's very rewarding.
It just makes me feel great of what we do here at the Supply Chain Center.
And then you stop and you think about, okay, these prices that we're negotiating are going to affect how much the doctor's going to charge that patient, and how's that going to affect the patient?
Whether it's increasing quality and lowering cost, and just making sure that the supplies and medical products are there when needed, like during our delivery in our car.
Does it impact patient care? And that's one thing that I always like to fall back on. You know, I think research is very, very important, but also patient care is our #1 priority.